Today we are going to talk about trauma, and we have with us Dr. A. Marthanda Pillai, who is a neurosurgeon. Let us welcome him to the program. Welcome, doctor. Firstly, we would like to know more about you.
I am a neurosurgeon. I have been in the Trivandrum Medical College as a professor and head. Presently, I am chief consultant neurosurgeon in a private hospital. I had my basic education in Trivandrum Medical College itself, then post-graduation in CMC Vellore, Krishna Medical College Vellore. Then I had a higher education at UK, took my FRCS and joined the medical education service in Trivandrum, where I have been there for a long period.
How common is road accidents?
Road traffic accidents are increasingly becoming more now, particularly in Kerala, where the number of vehicles are disproportionately high, but the road conditions still remain as it is for the last 10 years or more. It is a major public health problem, mainly because those who are involved in road traffic accidents, they are youngsters. They are between, say, 18 years to 35 to 40-year age group. Those who are in their most productive and most efficient age group. So we are losing that age group people just because of the road traffic accidents. When you consider the death rate as it is, in this age group, if you take road accident and death is more common. But if you take the whole population, then of course cancer leads the list, followed by heart disease. But if you take the age group in 25 and 45, the most common cause of death is road accidents.
How first aid is useful for preventing death and weakness?
The concept of management of trauma, particularly head injury, is fast changing. Before, we had to wait till the patient reaches a hospital with facility before you can initiate treatment. Now, as things are becoming better, we have the ICU ambulance so that start the treatment at the site itself. Of course, at the site you cannot do much, but definitely you can give first aid. Purpose of treating the patient early is to prevent secondary damage, particularly if it is head injury. The accident itself has caused damage to the brain, damage to the skull bone, and damage to the blood vessels and all. But then, what is more dangerous is after the accident, patient obviously will be unconscious, and there may be fractures, so that a lot of blood loss will be there. So the blood pressure tend to be low. So much so, in a damaged brain, if the blood is not reaching it, it is going to cause secondary damage. Similarly, after an accident, most of the time you find that the patients vomit, and part of it goes to the lungs and block the lungs, so that the oxygen reaching the brain and other parts of the body also becomes less. So the primary objective of treating the patient, particularly from the site of accident itself, is to see that this secondary brain damage or secondary damage to other organs are prevented by seeing that the airway is patent. If necessary, even at the site itself, there should be trained persons who can put a tube and give artificial respiration. If the blood pressure is low, a drip has to be started, and you can use normal saline or dextrosaline, such IV fluids, so that the blood pressure is maintained and the oxygenation of the brain is maintained. And also to prevent the fracture becoming worse, and also to reduce blood loss. Suppose there is a fracture, if you don't stabilize it, there will be a lot of blood loss, not only from the wound, but even inside the tissue, there can be blood loss. So you may have to splint that particular part and apply bandages so that blood loss is controlled. And it is very important that at the site itself, you transport the patient properly. Many a time what we find is when there is a head injury, 16% of these patients can have a neck injury also. And if you transport the patient, say, in a three-wheeler or even in a car, the way you make the person sit, you are going to make the fracture worse. So you should always see that the patient is transferred in a stretcher into an ambulance, and also from the ambulance to to the hospital or even for scan and other things. You call it a spinal board. Structure is one which is normally available, but we have a spinal board on which if you strap the patient, then the spine movements can be reduced. So if that part is done initially, definitely the death rate can be reduced and even the morbidity because of the accident and the injury can also be reduced.
Okay, in what area you're more specialized in?
I am a neurosurgeon basically. So when an accident comes, the most fatal injuries are head injuries. All the other injuries are manageable a bit, but when you have a head injury, that is going to be the cause for death or even if you save the patient for morbidity.
To what extent does wearing helmet help a person?
Wearing a helmet definitely reduce the impact of the accident. To that extent, the severity of the head injury will be less. Even a head injury you can avoid most of the time. When an accident happens, the studies show that mostly the pedestrians are mainly involved. Maximum number of casualties will be among the pedestrians. After that, the number is as far as those who are using two-wheeler. The two-wheelers, they are more prone for head injury. Many of time, those who drive the two-wheeler, they use a helmet. Even that is not very compulsory in many other states. And those who sit in the back, pillion riders, they usually don't use helmet. But then, when an accident happens, it is the pillion rider who is more involved. Because at least the driver knows or guess that there is going to be an impending accident. So he will automatically take some precautionary measures. So he getting thrown into the road is much less. But those who are sitting in the back, they are not aware of, they are not anticipating what is going to happen in few seconds. And when that suddenly happens, he's thrown mainly on his head, he lands. And that's how head injuries become much more with pillion riders. Helmet can definitely protect your head because the helmet that you use sort of absorbs the force. When an object is suddenly put into a halt, something that is moving at a high speed, when it comes to a halt suddenly, a force is generated. So the force has to be spent on something. So if he does not have a helmet, what happens? The force acts on his head. It breaks his skull, it damages his brain. But when you wear a helmet, the force acts on the helmet. And there are so many layers which definitely absorbs all the force, all the energy, so much so the head is spared of the consequence of the energy or the force acting on the head. So that's how the helmet protects the person. And many a time, public has a lot of anxiety about using a helmet. If you wear it, whether your vision will be all right, whether your hearing is all right, whether your concentration will be okay. But then the helmet is made according to the international standards, which limit your range of eye movements, limit the hearing impairment, and other factors. So much so, you are much safer wearing it than not wearing it. It is only a matter of habit using it. When you first put it on, you feel heaviness and things like that. But when you routinely use, you get accustomed to it and you are very safe. A lot of people who do very dexterous work, say a pilot in a plane, or somebody who is working in a mine, or even army persons, they use a helmet. But their accuracy, their judgment, their concentration, it's not lost. So to think that wearing a helmet and using a bicycle or a two-wheeler is going to impair all these faculty is a wrong notion. So that awareness you have to bring in our public so that people will use more helmet, and definitely the head injury can be considerably reduced.
How do you treat trauma cases?
Trauma, as I already mentioned, the treatment starts at the site of accident. Only if it starts at the site of accident in terms of first aid, protecting the airway, see that blood pressure is maintained, the fractured segments are stabilized by splints or spinal board, and if he reaches the hospital, immediately again hospital rechecks the patency of the airway to see that oxygenation to organs are sufficient and see that the blood pressure is maintained. If these two are stabilized, then half of the treatment is over, or patient is stable. Then you transport the patient for CT scan, bone screening. Almost all part of the bones you have to take X-ray and exclude a fracture, particularly a spine fracture. Abdominal injuries are much common, so ultrasound you do for the abdomen, see whether there is any liver injury or other organ injuries are there. And after ascertaining the extent of injury, which are organs are involved, then of course you take a decision whether do operation or medical treatment, and you transfer the patient to ICU depending upon the severity. Usually in a well-equipped hospital, if it is a mass casualty, you call it as a triage, where you initially sort out the patients, those who are critically injured and those who cannot be saved. Then another category where they are critically injured but still you can save, and those who are minor injuries. So your concentration has to be in the middle group, where critically injured but still you can save. Other two categories can wait, less priority areas. So this group you immediately do whatever investigation things I've mentioned already, and then transfer the patient to the intensive care, where you monitor almost heart rate, the urine output, oxygenation, put the patient if necessary on ventilator, and medical management is what is mainly required. Even for head injury, only about 15% of the head injured patients require operation immediately. All the rest it is medical management, stabilizing all the basic parameters of the patient. You should also find out whether he has a heart disease previously, whether he is a diabetic, whether he has blood pressure, whether he is already taking some medicines. All these things are very important, so that if you just concentrate on the head alone, you find that the blood pressure shoots up more, the sugar becomes worse, and it can in effect cause deleterious effect on the patient. So that part is obviously very essential. Another aspect is that alcohol and driving. Drunken driving almost always causes fatal injuries. The postmortem studies that has been done, which definitely shows that the blood sample taken from them, at least 85% had alcohol levels very high. So there is a direct correlation between the amount of alcohol consumed by the driver and the severity of the accident. So that is one thing which a person should never do, drunken driving. It has to be stopped. Awareness about this has to be among the public. Now the recent evil is using a cell phone. You find that when you travel by car or whatever, you find every other person is always using a cell phone. Even a pedestrian should not use it because an accident can still happen. But a driver should never use it. Studies have shown that persons who are above 45, if you use a cell phone while driving, 85% concentration is lost in them. So an accident and not having an accident, the time required is seconds. So your reaction time will definitely be affected if the person has taken alcohol. From 5 seconds, if it becomes 15 seconds, then an accident will definitely happen. Similarly, using a cell phone is definitely going to prolong your reaction time. You see an accident, but before you react to that situation, an accident can happen. If you are using a cell phone or if you are consuming alcohol, that reaction time becomes prolonged. So both these things should never be used while driving. If you want to attend a call, then you park the car and attend the call. Or even if you want to call somebody, you park the car and do it. So by doing this alone, definitely the death rate and disability can be considerably reduced. And more than that, if you when we treat patients with head injuries, those who are alcoholic, we find that the tendency for them to recover is less. They take more time for recovering from an injury because their organs are already damaged, particularly the brain is damaged. And they have a lot of behavioral problems after the accident, a person who is an alcoholic. So on a long-term basis, it is better that these vices are not there.
Thanks a lot, Doctor, for being a part of our program.
Thank you.
So that was Dr. Marthanda with us. Until we meet next time, this is me, Naina, signing off. Take care.
Oh,